Welcome to the Psychology and Physical Training channel. Have you ever wondered, what are dissociative disorders? Perhaps you've heard the term and want to delve deeper into its meaning, or maybe you're new to the world of psychology and are curious about this fascinating subject. Dissociative disorders are a complex and intriguing area of study, one that can shed light on the intricate workings of the human mind. So, are you ready to embark on this journey of discovery? Stay tuned as we delve into the fascinating world of dissociative disorders. Defining dissociative disorders. Dissociative disorders. What do these two words mean? Let's dive into this intriguing topic. Dissociative disorders are a family of psychological conditions that fundamentally disrupt an individual's mental processes. They're like unwelcome guests, intruding upon a person's thoughts, emotions, perceptions, behavior, memory, and even their identity. Imagine the human mind as an orchestra, with each instrument playing its part to create a harmonious symphony. Now imagine if one or more of those instruments suddenly went off key or stopped playing altogether. The resulting discord is akin to what happens in the mind of someone with a dissociative disorder. At the core of these disorders lies an involuntary escape from reality, characterized by a disconnection between thoughts, identity, consciousness, and memory. People from all age groups and racial, ethnic, and socio-economic backgrounds can experience dissociative disorders. The essential feature of these disorders is a disruption of and/or discontinuity in the normal integration of consciousness, memory, identity, emotion, perception, body representation, motor control, and behavior. This disruption can lead to difficulties in a person's everyday life, impacting their ability to function normally and maintain social or occupational activities. Now you may be wondering, how does this disconnection occur? It's not a simple case of forgetting where you put your keys or spacing out during a long meeting. Dissociative disorders involve a chronic and recurrent disconnection, where a person may feel detached from their body or experience their reality as unreal, dreamlike, or distorted. One key point to remember is that these disorders are not a sign of weakness or a character flaw. They are complex mental health conditions that arise from a combination of factors, including severe stress, trauma, and often a history of early life trauma. Understanding dissociative disorders is like piecing together a puzzle, where each piece represents a different aspect of the human mind. It's a complex task, but a crucial one, as these disorders can significantly impact a person's life. So, dissociative disorders are complex mental health conditions that can have a profound impact on a person's life. In our upcoming scenes, we'll delve deeper into the symptoms, types, and etiology of dissociative disorders. So stay tuned. Key points about dissociative disorders. Here are some of the crucial points to understand about dissociative disorders. Foremost, dissociative disorders are not a choice. People don't decide to dissociate. Rather, it's a psychological response to overwhelming stress or trauma. It's a coping mechanism that allows a person to disconnect from their surroundings or themselves when reality becomes too difficult to tolerate. What's fascinating about these disorders is that they are often born out of intense trauma or prolonged stress, such as childhood abuse or war. The mind, in an attempt to protect itself, creates a disconnection from reality, leading to a disruption in identity, memory, or consciousness. This disconnection is not a sign of weakness or insanity, but a testament to the mind's resilience and its remarkable ability to adapt and survive. A key point to understand is the significant disruption that dissociative disorders can cause in a person's life. This isn't just about occasional forgetfulness or daydreaming. It's about experiencing a disconnection so intense that it interferes with your relationships, your work, and your sense of self. It's about feeling detached from your own body or having a sense of the world around you as unreal. It's also important to note that people with dissociative disorders are not faking their symptoms. The experiences they go through are very real and can be extremely distressing. Unfortunately, the stigma surrounding these disorders often prevents people from seeking help, exacerbating their suffering. Lastly, dissociative disorders are treatable. With the right combination of therapies, including cognitive behavioral therapy, dialectical behavioral therapy, EMDR, and more, individuals can learn to manage their symptoms and lead fulfilling lives. The complexity of dissociative disorders makes them a fascinating area of study. They challenge our understanding of the human mind, its capacity to survive, and the profound ways it can adapt to stress and trauma. Understanding these key points can help us better comprehend the nature of dissociative disorders. Symptoms of dissociative disorders. Dissociative disorders manifest in various ways. Let's explore the symptoms. Dissociative disorders are complex and multifaceted, presenting a range of symptoms that may often be mistaken for other mental health conditions. The most striking symptom is memory loss, which is not due to a physical injury or a medical condition, but rather a psychological response to stress or trauma. This isn't your typical forgetfulness. Individuals with dissociative disorders may experience significant gaps in their memory, forgetting personal information, past experiences, or even entire periods of their life. This memory loss is often episodic, with periods of amnesia alternating with periods of relative clarity. Another common symptom is the presence of other mental health problems. Anxiety and depression are frequently reported alongside dissociative disorders. Individuals may also experience episodes of derealization, where the world around them seems unreal or dreamlike, and depersonalization, a disconcerting sense of being detached or disconnected from oneself. Perhaps the most perplexing symptom of dissociative disorders is a change in identity. This can manifest as a shift in behavior, preferences, or even physical characteristics that seem to indicate a different identity or personality has taken hold. In extreme cases, individuals may have multiple identities, each with its own distinct name, personal history, and characteristics. These symptoms can be disconcerting, even frightening, for both the individual experiencing them and those around them. However, it's important to remember that these symptoms are not the mark of a broken or defective person, but rather a sign of a mind trying to protect itself from distressing memories or experiences. Ultimately, understanding these symptoms is a crucial part of identifying dissociative disorders. It's not about labeling or stigmatizing, but rather about recognizing the signs that someone might need help. Because the sooner these symptoms are identified, the sooner an individual can begin the journey towards recovery. Recognizing these symptoms can be the first step towards seeking help and treatment. Types of dissociative disorders. Dissociative disorders are not a one-size-fits-all condition. Indeed, they come in various forms, each with their unique characteristics and manifestations. Let's delve into some of these types to gain a clearer understanding. Firstly, there's dissociative identity disorder, formerly known as multiple personality disorder. This disorder is characterized by the presence of two or more distinct identities or personality states that recurrently take control of an individual's behavior. Each identity may have its own name, personal history, and characteristics, including obvious differences in voice, gender, mannerisms, and even such physical qualities as the need for eyeglasses. There may be gaps in memory for important personal information that can't be explained by ordinary forgetfulness. Secondly, we have dissociative amnesia. This involves disruptions or breakdowns of memory, consciousness, or awareness brought about by extreme stress, excluding physical causes. There are several subtypes of dissociative amnesia, including localized amnesia, selective amnesia, generalized amnesia, and systematized amnesia. The most common type is localized amnesia, where a person can't remember a specific event or period of time. Finally, let's talk about depersonalization-derealization disorder. This is a type of dissociative disorder that consists of persistent or recurrent episodes of depersonalization, derealization, or both. Depersonalization is described as feeling detached or disconnected from oneself, observing oneself from an outside perspective. Derealization involves experiencing the world as unreal, dreamlike, distant, or distorted. These are just a few of the many forms of dissociative disorders. Each one is unique, just like the individuals who experience them. But despite their differences, they all share a common thread: the disruption of normal cognitive processes, leading to significant distress and impairment. Understanding these different types can help individuals and healthcare professionals identify and treat the specific disorder effectively. By gaining a deeper comprehension of these disorders, we are better equipped to empathize with those affected, ultimately fostering a more compassionate and understanding society. Etiology of dissociative disorders. But what causes dissociative disorders? This is a question that has puzzled many. Dissociative disorders, like many mental health conditions, don't have a single clear-cut cause. Instead, they often result from a complex interplay of factors. A leading theory in the field of psychology suggests that severe psychological stress or trauma, particularly during early childhood, plays a crucial role in the development of these disorders. This trauma could take many forms, from physical or sexual abuse to witnessing a violent event. The young mind, unable to cope with the intensity of the situation, might resort to dissociation as a defense mechanism. This can lead to a pattern of dissociation that persists into adulthood, manifesting as a dissociative disorder. It's also worth noting that individuals with a family history of dissociative disorders or other mental health conditions might be more susceptible. This underlines the potential contribution of genetic factors in the onset of these disorders. However, it's important to remember that not everyone who experiences trauma will develop a dissociative disorder. Other factors such as personality traits, coping mechanisms, and social support can also influence the likelihood of developing a disorder. In conclusion, while the etiology of dissociative disorders can be complex and multifaceted, trauma often serves as a common thread. It's not a one-size-fits-all explanation, but it provides a framework for understanding the roots of these disorders. Though the exact cause can vary, trauma remains a common thread in the etiology of dissociative disorders. And if you like this video, do not forget to subscribe to the Psychology and Physical Training channel for more videos. Thanks for watching.